I sure am. Just
All right, go ahead.
share my slide first, so I can get ready before you.
Sure.
Okay, Uli, thank you very much for letting me inviting me to present SoundWise. My name is Susan Gunduz. I'm a pediatrician located in New York, and Stephanie Denton, who's a pediatrician located in Alabama. We're co-founders of SoundWise, and we're really proud to tell you how much we've done for our patients so far through this company. What's the good that we've done? It's a pediatrician developed AI-powered child enrichment for reading, writing, motor skills. It's not AI yet, but we're working on it. So the statistics show that students are falling behind. 67% of fourth graders read below grade level, and 75% of those kids never reach reading proficiency. Decades of statistics that have only worsened by the COVID impact. We have to change. Doing the same thing over and over again and expecting change is really crazy. Relying on the status quo is little too late. Issues that come up are delay in services. We work with early childhood, so children 3 or 2 or older. The services to get it takes 6 to 9 months for speech and other services that are necessary. And time when they're in school and they need services, that also takes many months. And when mom and dad go outside, it's very expensive. And a lot of times the parents are told, let's wait and see. It's developmental. Every child eventually catches up. That's not acceptable. It's just procrastination. We need to replace the wait to fail approach. And what I mean by that, most kids wait, that most schools wait till 4th grade to do a formal evaluation. And by that time, they're very, very delayed. We did a clinical study, 600 patients in our office, and we found in our assessment tests for ability to identify letter identification and sounds. And those kids that could not do it, let's say the 4, 5, or 6-year-old, we saw just by telling the mom what to do, very simple, we saw a 69% improvement 3 months. Drawing, holding the pencil correctly. I mean, if the child's holding it fisted and you're asking them to write the ABCs over and over again, it's going to take them longer and with trouble. So we know to discover this early before school entry, 51% improved after 3 months. Overall, the improvement was greater than 50% of all categories after 3 months. And we found the positive predictive value for dyslexia was 95%. That's great. We can pick that up and work on it. Our assessment is interactive. Right now, pediatricians are given a screen that's a questionnaire like Stage and or the PEDS, and they have mom fill it out. We watch the kid draw, hold the pencil, speak. We ask questions. How do you pronounce this? How do you rhyme? So we evaluate for speech and language, fine and gross motor, social, emotional, and more. For example, child's not able to focus or anxious, crying, and autism. We're able to say, hey, wait a minute, let's go further on this. AI allows for scalability, consistency, and it's unbiased. I've noticed that in my office, when one person gives a test versus another, there might be some discrepancy. The assessment takes 15 minutes, even less if the child gets a perfect score. And it's AI automatically scored, that's what we hope. The enrichment modules are prescribed specific to each child, customized. Performance is monitored over time to ensure continued progress. SoundWise becomes your child's personal AI tutor. Personal AI tutor. So AI interacts with the student visually and verbally. So what I mean is you say, okay, show me the picture of the 3 red circles. They can check it, they can say it, they can point to it. We're having speech recognition. It's going to be able to recognize different accents and dialects, letter sounds, phonological awareness, and speech recognition, computer vision for ability to check gross motor planning, fine motor, AI recognition for behavioral disorders. We have to go further if we have a child that's not really working with assessments, combative or crying. The assessment leads right into enrichment. As I said, it's on all mobile devices, and we have an online portal for resources for the parents and for them to view progress. I'm sorry, I have to go back one, went too fast. Our solution benefits all children and their parents. It reduces the risk of reading failure. We've seen this in the office over and over again. Parents come in and, you know, especially the kids from second language families, those kids that are disadvantaged geographically or economically, but it affects everybody. There's a lot of attorneys that come in and they say, I don't know what my kid needs to know for school. And, you know, he's having trouble. Hey, I'll tell you, work on it. Doctors, we're already getting paid. We're using a CPT code for our assessment. We're getting paid for it, which is really nice to see. Early intervention, and also doctors don't have time to do this. That's why we have to get on a computer platform using AI. Early intervention centers, talking to my local New York center, takes 12 months to get an intervention service to the parents' home. Terrible. And she says it's nationwide. Daycares, they're not developmental specialists. Payers, less mental health disparities. We see it in our office. Really is true. They're much happier. They raised their hand. I have one kid that started learning different languages and didn't even know any letters or how to hold a pencil. Taxpayers, less children needing special ed services, and the US economy will rely less on social services. Here's our milestone, a regulatory path. We're looking for seed fund, obviously. We don't have it on a computer platform yet. And we applied for a grant, an NSF SBIR grant. We made the initial pitch that was accepted, and we're going to the second phase. We did a non-provisional utility patent for child evaluation system and method of use that's pending. And we hoping to do this AI build out and the FDA approval. And I know that we can get that, and product launch venture, hopefully. Our competition, let me just go over. Dissolve is a dyslexia company. So yeah, it's great. It uses AI, but it's for the kids who kind of know, okay, I think I had dyslexia because it's genetic and my mom had it. I want to go straight there. Or it's fourth grader and they're not doing well. And formal testing show that we start early childhood, 3 and under, up to the age of 9. We are a pediatrician model for early intervention. We score with AI like the iReady. iReady is given at age 5 for kindergartners. There's nothing really for 4 or 3. Early bird in New York, in some places they're doing age 4. But that's another dyslexia company. So we measure fine and gross motor impairment. None of them do. We're the only one. We evaluate focus, following directions, completing tasks as we ask. We watch them do these things. None of the other ones do. iReady, if you don't do well, they send the parent a letter and says, look, your child's not doing well. This is how they score percentage-wise based on other kids in the county or the school or the class. Mom doesn't want to know that. They want to know what to do. We also diagnose and treat other medical conditions, ADHD, anxiety, autism. We give referrals. This is our value proposition and market size. Look, we're new at this. These are the numbers. You have any questions, I'll try my best to answer. We're figuring we're doing $250 a year per student. Revenue stratus, subscription model, parents, schools, and daycares. We had 4 meetings with the chancellor's office in New York City for all the public schools. But because we're not on a computer, they really couldn't work with that. Teachers didn't want to do it on paper. I don't blame them. Licensing, either pediatricians or teachers, of course, pediatric offices. I'm already getting paid, which is exciting. School districts, daycare, to get into the state system is great. They need it. They don't have anybody trained. Early intervention centers, parents and homeschooling, reasons to invest. Significant unmet need. 48 million US adults cannot read above 3rd grade level. It's really true. And a lot of kids who don't read well below grade level, they have low self-esteem. They're depressed, anxious. They don't complete high school, incarceration, problems. Large US market opportunity, 6.1 billion TAM. And we have, and I want to tell you that our identification and our enrichment is evidence-based assessment, enrichment based on AAP guidelines. And we do everything simultaneously, fine motor, gross motor, and speech. And that's our team. And that's Dr. Denton. She's listening in, so I'm sure she'll have comments. And I'm going to stop sharing. Is that okay? Yes?
Sounds good. Sounds good.
Okay, how can I help?
All right, let's
I did it.
um,
10 minutes.
let's start with Gary. 1 minute.
Okay.
Yeah, Brian. Okay.
So I understand the problem, you know, and both from a clinician and from a venture capital perspective. I'm a little leery about the size of the market, but I see your slide. What I'm a little unclear as, and again, I hate to do this because this is such an important issue, but when I wear my venture capital hat, I have to, is who's paying for this and who's the customer?
Well, the customer are the children, and in pediatricians' offices, as long as they're getting paid, they're going to pay me to do this because we get paid about $90 to $100 per screen. That's a lot of money for a pediatrician. When the fact is that, you know, we're not getting paid for a lot of things that we do that we think we deserve. Okay, schools. Schools are really important too. 3-year-olds, preschools and state centers, they would adopt it. I spoke with early intervention and they need a solution, but they don't have one. I can't give them paper. I have to get on a computer system to give them the solution. 4-year-old preschools, they are our customers, and homeschoolers for sure.
So, but I guess I'm still not clear on the answer. So, I mean, is it the parents that are paying this?
The parents
For their child, or is it the insurance, or is
the
it the
parents are
state
paying.
if the child? Yeah, go ahead.
Yeah, Susan, I'll answer that. For Gary, we would like it to be done in each well-child visit. So when they come in for a 4-year checkup, a 5-year checkup, this be part of the screen and it be billed through the medical insurance. That's why we're able to capture all children through the pediatric network and help do early intervention.
And is there a code for this right now?
Yes. And it pays.
Okay.
It pays.
Thank
What did it pay? About 96.
As far as Medicaid, they
Yeah,
didn't reject it, but they said that you have to put different codes. We're going to be working with them.
Yeah. So when you're talking to VCs, I think it's important to have that kind of slide in there, you know, maybe even at the end, because this is, you know, it's like pediatric oncology, right? You know, it's really important, but it's the last thing you want to know about because it's of the topic, but it's important from an investment perspective.
Okay, thank you.
Mm-hmm. Sure.
Jay?
I would love to know a whole lot about the last guy in the lower left of your last slide. It seems to me this is a bet on Eric or whoever is. I mean, if the investors coming in, they got to get over the hump on Gary's question and a bunch of things related to the business, but this is a big business. We know a lot about this space. So therefore, I don't want to oversimplify it, but what's Eric all about? How are we going to go from paper to some cool whiz-bang technology that has great workflow, easy for the doctor's office to administer, easier for the kid. The parent loves it. It's just got to be so. We need to know more about Eric's credentials to get you from analog to Silicon Valley.
Hey, Eric, get on the line. Yeah, come on.
I didn't know Eric was here. I didn't mean to put him on the spot, but there we go. Okay.
Tell us about Mr. Vargas and about hopefully Harvey
Basically, I'm working with SoundWise to help build out the website and also like make contacts with possible investors, as well as mainly work with the engineer because of my background and design the website. And that's what I'm currently doing is I'm designing the current website we have on Wix and just kind of working with the engineer to do that. As well, along with Andrew Denton as well, who is also part of our co-founding team. But he's more specialized in marketing, so he's helping more out with the marketing side, and I'm helping more out with the technical side.
Eric and Andrew come from the perspective, they're young, they're dyslexic, and they know the struggle. And when you look at the end consumer, you really have to look at it from the people on the front line and how they would view this tool. Is it accessible? Is it something they want? So I think that they give us a unique perspective.
And we did,
Okay,
okay.
all right, I think time is up. Let's move on. Thank you very much, Susan. Thank you.